Prostate cancer is the second highest cause of cancer-related deaths in males. Approximately 18,000 Australian men will be diagnosed with prostate cancer this year alone. Prostate cancer occurs in 4 stages. In its first 2 stages, the cancer remains localized to the prostate before spreading to nearby tissue in stage 3, and then metastasizing to bones, lymph nodes, and other organs in its final stage. Current management involves surgical removal and/or radiation therapy. If the cancer is invasive, androgen receptor inhibitors are used. However, recurrent castration-resistant prostate cancer often occurs due to reactivation of androgen receptor pathways through alternative mechanisms. Thus, malfunctioning of signaling molecules, including transcription factors, oncogenes, and tumor suppressor genes, contributes significantly to the growth and spread of the disease. We wish to target SNORA42, a box HACA small nuclear RNA which provides a mechanism for a number of the hallmarks of cancer, including the activation of invasion and metastasis, the ability to resist cell death, and sustained proliferative signaling. However, we will focus particularly on SNORA42's ability to activate invasion and metastasis in cancer cells. SNORA42 is a non-coding small nuclear RNA with a locus at 1q22, a region frequently amplified in cancer. In normal cells, SNORA42 provides housekeeping functions but is upregulated in cancer, acting to control cell fate and oncogenesis. This overexpression increases cell migration and ultimately leads to metastasis, specifically promoting epithelial to mesenchymal transition by the SNORA42-induced upregulation of ZEB1. This is possible as SNORA42 acts as a ribonuclear protein within a complex to target RNA for pseudouridylation. This post-transcriptional modification was thought to only occur in non-coding RNAs. However, there is evidence that this may occur with mRNA as well, providing a clear pathway for SNORA42 to influence ZEB1 expression. This in turn influences cancer progression and invasion and metastasis as ZEB1 represses E-cadherin. Normal cell alignment is preserved by E-cadherin through the formation of dimers. It also acts as a cytoskeleton and controls cell adhesion. ZEB1 can specifically bind with E-cadherin to inhibit these effects, resulting in E-cadherin having the ability to move around undeterred in the extracellular matrix, thus advancing the rate of epithelial to mesenchymal transition. Furthermore, levels of N-cadherin, the mesenchymal-specific cadherin, and renentin, a marker of mesenchymal cells, are increased with upregulation of SNORA42 and thus ZEB1.
SNORA42 was initially identified as a potential biomarker for lung cancer, but has since also been identified in colorectal, breast, and now prostate cancer, making it a highly suitable candidate for treatment as these cancers all have high susceptibility to metastasis. We aim to target SNORA42 by using a small inferring RNA, whereby double-stranded DNA causes gene slicing by targeting complementary RNA strands for degradation. It has been found, in culture, that SNORA42 can be knocked down by specifically designed siRNAs to reduce levels of cell migration and invasion. However, they can be modified to be used in vitro to provide high specificity to the target, in this case, the nucleolus of the cancerous cell. siRNAs have been found to be efficient and effective at knocking down gene expression and are easy to design with very high specificity and low toxicity. However, as they are nucleotide based, they are easily degraded by enzymes in the blood or other interactions with blood components. Furthermore, naked siRNAs have a non-specific uptake and may be interfered with by the immune response. Yet siRNAs can be modified to increase their stability in vitro, with some success found in targeting prostate cancer in mice when a different iRNA was complexed as a catatonic liposome and injected intravenously. Thus, we are confident that optimization of these systems and further research will provide avenues to make this possible, conferring positive effects to cells not in culture.